Okay, so we are going to start the skeletal system, which is Chapter 7, and this is Lecture Video A. Our bodies contain roughly about 206 bones. They also, of course, have cartilage, and together this forms the skeletal system. Now, we have basically two different divisions of the skeleton. We have the axial skeleton and we have the appendicular skeleton. And this picture is in your text, and the orange, anything that is colored orange, is part of your axial skeleton, and everything else that is your normal bone color is your appendicular skeleton. And so we'll come back to this image a lot, especially in lab. You definitely will be using this a lot. So let's look at the axial skeleton. It forms the body's longitudinal axis. It encases cavities, which protects very important organs. There are basically three different parts of the axial skeleton. The first one, of course, is the skull. The skull has 22 bones, 8 cranial and 14 facial. It protects the brain. It also forms your face. The second part is the vertebral column, which has about 33 bones. You have 24 vertebrae, individual vertebrae that are stacked on top of each other. They do have a pad of cartilage separating those, and they protect the spinal cord. And then the remaining vertebrae are fused together, which forms your sacrum and your coccyx, which are virtually separate bones. And then you have the thoracic cage, or you probably have heard this called your rib cage. You have 12 pair of ribs, a sternum, and of course the vertebrae, the thoracic vertebrae of the vertebral column. The thoracic cage protects the lungs, the heart, and other delicate organs of the thoracic cavity. Now, your appendicular skeleton includes the bones of your pectoral girdle, which is, you probably heard your shoulder girdle, your upper limb, your pelvic limb, and your lower limb. And the primary purpose here is for movement, support, and to allow a place for muscles to attach. Your pectoral girdle has 2 bones, clavicle and scapula, and it anchors the arms to the trunk. Okay, so it supports the arms. And then your upper limb has 3 parts. You have the arm, which is the humerus. This is the top portion. And then you have your forearm, which has 2 bones, radius and ulna. And then you have the wrist and hand. The wrist contains carpals, which are 8 small bones there. And then you have the metacarpals and then your phalanges, which are your fingers. The lower part of the appendicular skeleton includes the pelvic girdle, which has 2 pelvic bones and a sacrum, and then together these are called the pelvis. It of course anchors the lower limb to the trunk, and then you have the lower limb, which has the thigh, which is your femur bone, the leg, which contains your tibia and fibula, and then you have your ankle and foot. You have tarsal bones that make up the ankle, metatarsals, and then of course you have phalanges for your toes. But before we get into the separate bones, we need to look at some bone markings. Bones have a lot of surface features. Some of these are depressions, openings, projections. There is a table in your textbook, 7.1, and it gives all the numerous surface features of bones, and all of these demonstrate that structure function core principle that we discussed in Chapter 1. For example, depressions provide a pathway for blood vessels and nerves. They could also be a place for joints, which are articulations between bones. Openings are, they enclose delicate structures. They also allow things to travel through the bones. And then you have projections, which are the sites where bones articulate or where you could have ligaments and tendons attach. Okay, so these are some examples. This is the image that it shows in your textbook. So I strongly encourage you to become very familiar with the bone markings. And as you get into lab and have to start learning the bones and their features, you are going to have to start looking and learning what these markings are. Okay, so we're going to start with the skull. We already said it has 22 bones, and there's 2 groups. You have the cranial bones, which there are 8 of these, and we sometimes call these the cranium. Now, the 8 bones are divided up this way. You have 4 single bones. So you have the frontal, which you probably, if you know your body regions, which you should know exactly where that is. The occipital, again, that's at the back of the head. You should know where that is. Your ethmoid and sphenoid are more internal bones, and we'll have to look at those, and we'll look at those today in lab. And then you also have 2 paired bones. And by paired bones, we mean you have 2 of each of these. So you have 2 temporal bones on each side, and then you have 2 parietal bones on each side. And then the other part of the skull is your facial bones, and this of course forms your face, and there are 14 of these. 6 of these are paired. So you have 2 maxillary, 2 2 zygomatic, 2 nasal, 2 lacrimal, 2 palatine, and 2 inferior nasal conchal bones. And then you have 2 single bones, your mandible and your vomer. Now, this is an overview of the skull structure, and this is a nice color-coded picture, which is easy or good for you when you're first starting out. It makes it easier to be able to really tell the difference in these bones. But you can see they're labeled here. The big orange in the front, of course, is the frontal. The yellow is going to be your parietal bone here. It's labeled. Your sphenoid, you can see part of it here in the purple. The green here is your temporal, and then the occipital, you can see a tiny sliver of it at the very back. Your mandible here, you have your 2 maxilla, your vomer, you can see a small portion of that there. You can see the small part of one of your inferior nasal concha bones. You can see the zygomatic, the pink cheekbones. The palatine, you can see a little piece of that there. The lacrimal right inside that nasal cavity, and then of course your 2 nasal bones. So of course some of these you can't see well because of the view that we're looking at the skull. Now, all of the bones of the skull are fused to one another, and they form these immovable joints called sutures. The only exception is the mandible, which is the lower jawbone. You have 4 major sutures: the sagittal, the coronal, the squamous, and the lambdoid. And these sutures, again, are where the bones are joined together, and those joints do not allow for any movement. A lot of the skull bones have sinuses, which are spaces that are air-filled, but they are lined with a membrane. You've probably heard sinuses. They cause a lot of problems for some people. We're going to take a second just to look at some different views of the skull. When you're first learning the bones of the skeleton, the view is very important because you can't see every bone from every view. So this would be an anterior view, which you know is looking at the skull dead on from the front. You can see all the facial bones here. Some of them are only visible in the orbit or in the nasal cavity, like your vomer, and also a piece of your palatine bone can only be seen there in your inferior nasal concha. And there are certain cranial bones that are also visible here. You can see the frontal really well there, okay? And this is the non-color version, which is what's in your lab book. We know our bones are not colored, and so once you become familiar with this, you need to start training yourself to be able to pick out these bones on the plain white skull. Okay, so it again shows you everything labeled there. This would be a lateral view, which is from the side. You can see your parietal bone really well. You can see the temporal bone really good. You can see the occipital bone well. It shows your sutures. Right here is the squamous, where my mouse is following. There's squamous. Down here, separating the blue occipital from the yellow parietal, is your lambdoid. Above here, separating the orange frontal from the yellow parietal, is the coronal suture. So there's 3 of your major sutures shown there. You can also see the greater wing of the sphenoid bone. You can see a nice picture of the L-shaped zygomatic. You can see the ethmoid, a little piece of it, and the lacrimal, and of course the little piece of the nasal. You can see the maxilla, which is your upper jaw, pretty well. You can see the mandible very nicely. And so anyway, you can see some good, a lot of those side features really well from this view. And then of course you have your plain, your real skull view, which you need to again be able to do that without the color. This is a posterior view, so you're looking at the back. It tells you a really good picture of the sagittal suture, which divides your 2 parietal bones. So you have a right parietal and a left parietal. You can see a great occipital here. You can also see that lambdoid suture that separates it. You can see the mandible, and then you can also see part of the temporal bone here. All right, here is a superior view. So if you were just looking on top of the head, you can see 3 of your sutures really well. Of course, you can see the coronal. Here's the anterior, so that's the front of the skull. This is the frontal bone. You can see the sagittal. Remember, sagittal plane goes right down and divides into right and left halves. That's why we have sagittal suture here. So you divide your right and left parietal bone, and then you have the lambdoid suture, which divides your parietal bones from this blue occipital bone. So again, this is a good view to see some of those major sutures. This is an inferior view. So if you were looking from underneath the skull. You can see this nice space here, which is the foramen magnum. This is where the spinal cord meets the brain, very important region there. You can see a nice picture of the occipital, then temporal here. You can see lots of openings where lots of blood vessels and nerves have to pass through the bones. You can see the palatine really nicely here in that horizontal plate. You can see the inferior nasal concha there. You can also see the two maxilla. So this is a nice view of the inferior. You have to hold the skull basically upside down if you want to look at this particular view of the skull, which I do recommend to do. Now this last one is a medial view. So this is if you were to cut the skull in half and then look from the inside. Okay, so this gives you a different view as well. And again, there's the real skull version of the medial view. Okay, and then just another overview. This is an internal. So if you were to take the cap off, the base, we were looking at the top of the skull, and you just take the top half of it off. This would be a nice internal view of the skull. And again, you can see a lot of those major bones really well here, as well as a lot of openings. Okay, so we're going to stop there. We will pick up with the hyoid and get into the vertebral column in the next video.